I'm here to provide you with some updates on the local preparedness within the Trinity Health Organization of what we're doing with the Ebola outbreak as it unfolds in the West African nations and is increasingly involving the United States throughout this time. Currently, Trinity has developed an Ebola preparedness leadership team consisting of myself, Dr. Gons, Joan Mulrooney, and several other of our high administration level. We are currently having meetings to figure out the best way to protect our healthcare institution. The primary goal of these series of meetings has been to prepare the health system to provide the best possible care we can to a potential Ebola patient, while at the same time protecting all of our staff, all of our other patients, and all of our visitors by minimizing the risk of transmission of this serious disease. The things that we have unfolded at the current time is we have a dedicated care team that is being assembled that will then provide the care to this patient. We have dedicated points of entry, all of which are being screened for appropriate at-risk persons. When a patient is identified as at risk and has appropriate symptoms that will then be quarantined and need tested for the Ebola virus, we have a dedicated pathway of flow to where that patient will be provided directly into a triaged room where they will receive all of the appropriate care measures with dedicated staff, dedicated equipment for the patient care, dedicated laboratory equipment, and appropriate protective care equipment that is being made available so that we can minimize any risk of transmission for a potential spread of a case. At the current time, all of the testing will be done locally within that room until we can stabilize the patient. If needed, we will arrange for transport to our tertiary care centers so that the patient can receive the appropriate critical care measures that they may require with such a severe disease. And we have our colleagues at the Ohio Department of Health that will be doing our local testing of all the serology samples for the actual virus to help us in this very severe illness at this time. Just wanted to make some brief comments on what to do if you are an individual that has been exposed to an Ebola patient, you've had travel to an endemic area, or you've had direct contact with not only the cases but the bodily fluids of the cases, the expired bodies that have been cases, or also bats or non-human primates in the endemic areas. At the current time, this is based off of the latest CDC recommendations. There is two specific protocols that should be followed. The first of which I'll refer to as the asymptomatic person at risk. Basically, this is a patient that is not currently developing symptoms of Ebola, but they are at risk because of their travel or exposure to a known Ebola case or the animals and such that I just outlined. The current recommendation is that these asymptomatic folks that have a heightened risk should monitor their body temperature twice a day with a thermometer, and they should monitor themselves daily for the development of the specific symptoms of Ebola. So those include fevers, vomiting, nausea, diarrhea, abdominal pain, rashes or petechiae, bleeding of any sort that's unexplained, as well as severe headache and abdominal pain. If any of those develop, that patient now has symptoms of Ebola with appropriate risk factors identified, and they should be cautioned immediately in quarantine to minimize their travel, minimize their exposure to others, and they should seek immediate emergency care for care of potential Ebola as it's unfolding. The sooner that these patients were to arrive at care and seek care, the better off their outcomes will be, and the minimum exposure risk of transmission will occur at the same time. On the contrary to that, if you are a person that has at risk of exposure to the Ebola virus, if you've been to the endemic areas or exposed to bats or non-human primates from the endemic areas, or you have direct contact with the bodily fluids of patients, then you are considered an at-risk person, and if you have the right symptoms compatible with the illness, such as fevers, abdominal pain, nausea, vomiting, diarrhea, severe headaches, petechiae, and bleeding, you are considered an at-risk person. You should, number one, minimize travel and exposure to others. At that point, you should also seek emergency medical care at your nearest care centers where the appropriate triage can be in place to get you tested for the appropriate virus specimens. CDC has graciously provided us with an Ebola hotline where anyone seeking additional information can provide at the number provided also, which you will see on the screen here shortly. Additional information can also be found at the Wealth of Knowledge, the CDC's website, which is simply www.cdc.gov. The main page there, you'll see a link for Ebola with all the latest information as it unfolds.